WhangāreiTim.
Thank you, Mr. Speaker. My question is to the Minister of Health. Is he committed to equitable health care for all New Zealanders? If not, why not?
Mr. Speaker.
The Honourable Simeon.
Mr. Speaker, my priority as the Minister of Health is ensuring that all New Zealanders have access to timely, quality health care. This government has invested more in health services than ever before, an additional $16.88 billion, and my expectation is that those services are delivered based on the need. Kiwis rightfully expect to see their doctor or attend emergency departments without long waits and get the surgeries they need as quickly as possible. My focus and the focus of this government is on ensuring that those expectations are met and delivered upon for all New Zealanders.
Supplementary. To the Minister, are top health researchers correct in saying, quote, health systems that rely on funding via private insurance are less accessible, less efficient, less equitable, and generally have worse health outcomes, end quote, and if not, why not?
Well, Mr. Speaker, many New Zealanders rely on our public health system, and many New Zealanders have private health insurance. And the private health companies do an amazing job, as do our public health system, to ensure that New Zealanders can access the timely, quality care that they need so they can live healthy lives. That's my focus as Minister of Health.
Supplementary. To the Health Minister, is Health Advocate Malcolm Mulholland correct that, quote, opening the health system up to more private sector involvement would only benefit the well-off? And if not, why not?
Well, Mr. Speaker, I think the Labour Party is in a very dark and conspiratorial place. I mean, we are focused on delivering the quality and timely health care that New Zealanders need and focusing the system on results. This government has invested a record $16.88 billion into our public health system, but I also say there are many parts of our healthcare system in New Zealand which are operated by the private sector, our entire GP system, our doctors, our doctor clinics, and I thank them for the work that they do delivering health care for New Zealanders.
Supplementary.
Supplementary. WhangāreiTim.
Thank you, Mr. Speaker. To the Minister, then can you explain to New Zealanders why they are waiting longer for health appointments and paying more for doctor's appointments?
Well, Mr. Speaker, because we've inherited a system which the last government decided to restructure during a pandemic. Instead of focusing on outcomes, they were focused on bureaucracy. And my focus is on getting the outcomes that New Zealanders need.
Supplementary.
The Honourable David Seymour. Hang on, just wait for a bit of quiet.
Is the Minister aware of the highly celebrated and very innovative partnership between the Hapu Ngāti Whatua or Orake and NIB, a private insurer, to provide insurance to the Hapu's members? And could understanding such real-world examples be helpful in such tasks as retaining the seat of Tamaki Makaurau?
Well, Mr. Speaker, I appreciate that question. And yes, there are many examples across our healthcare system of partnerships which the private sector is part of delivering. But what I can say is my job as Minister of Health is making sure that all New Zealanders have the access to the timely and quality care that they deserve. And this government has invested record amounts, and we will focus the system on delivering that.
Supplementary.
Point of order, Kieran McAnulty.
Thank you very much. I thought I'd give you the opportunity, but...
It's very generous of you.
Thank you.
Extraordinarily generous.
That question
But
at the end
very
of it
appreciative. Carry on.
clearly had a swipe at the member on the opposition asking the question. How on earth is it appropriate that a government minister can ask a question of another minister that includes an inference of an electoral result relating to the member asking the question? How is that appropriate?
I'll have a look at it offline and come back to you. WhangāreiTim.
Thank you, Mr. Speaker. To the Minister, does he agree with David Seymour's State of the Nation speech, which asked if we should, quote, allow people to opt out of the public healthcare system and take their portion of funding with them so they can go private, end quote, and if not, what's the Minister going to do to prevent the health system from being defunded and privatised?
Well, Mr. Speaker, that is not the government's position, but what we are focused on doing is about focusing it on delivering the outcomes that New Zealanders need: faster specialist appointments, doctor visits quicker, making sure there are more elective surgeries being completed, we have invested a record amount of funding in our public health system, and now we need to focus on making sure it is delivering the results that Kiwis deserve and expect.
Right Honourable Winston Peters.
I can ask the Minister whether he'll deal with the real issue here, though, in particular. Will he help restore Mr Hennare's health by getting his electoral
that's not
seat
a
back that
question.
was stolen off?
That question is out of order.